morning to our Rochester City School District families. I'm Marisol Ramos Lopez, Chief of Communications and Intergovernmental Affairs for the district. And it is my pleasure to welcome you this morning to our 21-22 School Opening Family Forum. Before we start the forum, we have some items to go over to ensure that all of our families are able to hear this presentation in their native language. This family forum will be translated live into 3 different languages: Arabic, Nepali, and Spanish. These interpretations will be recorded and made available on our website and to school communities to share with families early next week. A special thank you to our translators this morning. It is so important for the Rochester City School District that we are able to communicate with all our families. I would like to invite our interpreters now to introduce themselves and provide directions in their native language to let families know how they can participate in today's forum. Will the Spanish translator please introduce yourself and provide instruction?
Buenos días, mi nombre es Sergio y les doy las gracias por acompañarnos en el Foro de la Familia del Distrito Escolar de la Ciudad de Rochester. En unos minutos aparecerá un icono con forma de globo en el área inferior de su pantalla, una vez que se hayan activado las traducciones en vivo. Para escuchar el foro de hoy en español, selecciónelo en este menú desplegable. Además, para silenciar el audio en inglés y poder concentrarse en mí, haga clic en el icono del globo nuevamente y elija la línea que dice silenciar audio en inglés, justo debajo de la lista de idiomas. Gracias de nuevo por acompañarnos.
Thank you. Will the Arabic translator please introduce yourself and provide instruction?
مرحبا، أنا جيهان، أشكركم لانضمامكم إلينا في اجتماع أهالي الطلاب في مدارس الإدارة التعليمية لمدينة روتشستر. في غضون دقائق قليلة سيتم تشغيل خدمة الترجمة الفورية، وبعدها ستظهر أيقونة الكرة الأرضية في أسفل الشاشة أمامكم. للاستماع إلى الاجتماع اليوم باللغة العربية يرجى النقر على أيقونة الكرة الأرضية واختيار اللغة العربية من القائمة التي ستظهر أمامكم. بالإضافة إلى ذلك يرجى كتم الصوت باللغة الإنجليزية حتى تتمكنوا من التركيز على اللغة العربية فقط. للقيام بذلك يرجى النقر على أيقونة الكرة الأرضية مرة أخرى واختيار كتم الصوت باللغة الإنجليزية أسفل قائمة اللغات مباشرة. باختصار، عليك النقر على أيقونة الكرة الأرضية مرة لاختيار اللغة العربية ومرة أخرى لكتم اللغة الإنجليزية. شكرا لكم مرة أخرى لانضمامكم إلينا.
Thank you. Will the Nepali translator please introduce yourself and provide instruction?
Namaste, म जानुका मिश्रा, म रोचेस्टर सिटी स्कुल डिस्ट्रिक्टसँग होम ल्याङ्ग्वेज एसिस्टेन्टको काम गर्दैछु र आज भइरहेको फ्यामिली फ्रम प्यानलमा हजुरहरूलाई स्वागत छ र आज हामीसँग जोडिनु भएकोमा धन्यवाद। केही मिनेटमा तपाईको स्क्रिनको तल्लो भागमा एउटा ग्लोबल आइकन देखिनेछ। तपाईहरुले त्यसमा क्लिक गरेर नेपाली भाषा चुज गर्नुपर्ने हुनेछ अनि फेरि त्यो ग्लोब आइकनमा क्लिक गरेर इंग्लिश अडियोलाई म्युट गर्नुपर्ने छ किनकि तपाईले म नेपालीमा ट्रान्सलेट गरेको सुन्न सक्नुहुन्छ। त्यही भन्दै फेरि धन्यवाद दिँदै हामी सुरु गर्नेछौं।
Thank you. I'll ask us now to pause for a moment to let our translators do what they need to do to get set up. And again, I'd like to thank them for their assistance today. And now it is my pleasure to introduce the Superintendent of the Rochester City School District, Dr. Leslie Myers-Small.
Good morning. I am so excited to welcome you to our family forum today. I certainly want to thank all of you for joining us as we get ready to kick off a brand new school year. I want to address a concern that may exist for some of our families. We as a team recognize that there may be concerns about in-person learning. My decision to go 100% in-person is based on CDC guidance, so the Center for Disease Control, that says students benefit from in-person learning, and safely returning to in-person instruction in the fall of 2021 is a priority. In addition to universal indoor masking, CDC recommends that schools maintain at least 3 feet of physical distance between students within classrooms to reduce transmission risk. When it is not possible to maintain a physical distance of 3 feet, such as when schools cannot fully reopen while maintaining these distances, it is especially important to layer multiple other prevention strategies, such as screening, testing. School is the safest place for our children. We are working diligently to ensure that every precaution to ensure safety is in place. Screening, testing, ventilation, hand washing, and respiratory etiquette, staying home when sick and getting tested, contact tracing in combination with quarantine and isolation, and cleaning and disinfection are also important layers of prevention to keep schools safe. We have a lot of material to get through today, so I will be brief with my next set of remarks. We received hundreds of questions from participants prior to today's forum, and our presenters have incorporated most of that information into this presentation. Today's agenda will cover the following categories: health and safety, transportation, technology, visitors to our schools and programs, pivoting to remote learning, and finally, staying connected. Today's panel includes the following colleagues: Melody Martinez-Davis, who is the Deputy Superintendent of Support Services; Dr. Shirley Green, who is our Chief of Schools; Mike Schmidt, our Chief of Operations; Stephanie Morrill, Director of Transportation; Glenn Vandewater, Chief Technology Officer; Tim Johnson, Acting Executive Director of Instructional Technology; and Dr. Kathleen Black, Chief Academic Officer. Our plans for the 21-22 school year are based on guidance from the CDC and the American Academy of Pediatrics. This served as the platform for a cross-departmental working group that included teachers and school staff, principals, as well as administrators. They began this important work earlier this year and continued throughout the summer to help ensure a safe return to school. I want to thank them for their thoughtfulness, creativity, and commitment to health and safety. Now, Deputy Superintendent Melody Martinez-Davis will get us started. Melody.
Thank you, Dr. Myers-Small. Good morning. We are very glad to be here today sharing this information with all our families and hopefully many of our students who are also here with us today watching this forum. I will start with masks. Masks are required at all times, whether you're inside the school or outside the school, by everyone except when eating or drinking. Masks may be removed when a specific activity like speech therapy requires it. Staff may remove their mask when seated and 6 feet distanced in their designated workspace. Staff will wear masks whenever they are in student-occupied spaces and are interacting with other staff members of the school community. Students with an approved mask exception will not be required to wear a mask. They will be provided with 6 feet of distance unless necessary for an adult to provide needed support within 6 feet. Masks can be disposable or cloth and must cover the nose, mouth, and chin. Disposable masks will be provided to students and staff if needed. Protocols for student and staff enforcement are in place in all our schools. Now, with regards to social distancing for students, the district will maximize social distancing in all buildings and on buses. Students will be as distant as possible and may not be the same distance in every space. In some classrooms or spaces, students may be distanced up to 6 feet. In some instances, distancing may be 3 feet or even less to allow every student the opportunity to return to in-person learning. For adults, social distancing will maintain 6 feet of space from each other and students unless the task requires them to be closer. Masks will be worn by adults at all times when engaging in activities.
मास्क चाहिँ सबैको लागि महत्त्वपूर्ण छ र
In the cafeteria, when eating and drinking, cafeterias will be set up to maximize physical distance as much as possible. Meals may also be served in alternate areas such as classrooms or in staggered meal periods. Students will eat with the same small group for breakfast and lunch for an entire quarter. Masks will only be removed when actively eating and or drinking. Hand washing will also take place before and after meals. Now, when it comes to the personal protective equipment or PPE and supplies, these supplies will be provided to staff and students. Staff and students are encouraged to bring their own masks, and disposable masks will be provided to students and staff if needed. Gloves, face shields, and N95 respirators are available for employees that require more protection. The need for additional personal protective equipment will be determined by the task that is being performed. Soap and paper towels and or hand sanitizer and spray disinfectant will be available in all classrooms. Now, I would like to introduce Mr. Michael Schmidt, our Chief of Operations.
Good morning, everyone, and welcome to the 2021-22 school year. We have some very special people in operations that I want to recognize. First, our Director of Facilities, Mr. Tom Casa. Second, our Director of Safety and Security, Mr. Jim Shepard. Ms. Erin Groutman, our Director of Nursing and Student Health. Vandewater Akine, our Director of Food Services. And Stacy Darby, our Director of Environmental Services and Health, and Stephanie Morrell and Wayne Kittleberger, our Directors of Transportation. I want to start first by recognizing Stacy Darby, who will walk us through cleaning, ventilation, and testing. Stacy, good morning.
Good morning, everyone. I'm going to speak about cleaning, ventilation, and testing. Like Mike said. To start off, cleaning, the district will be following CDC guidance on cleaning and disinfection. According to the CDC in general, cleaning once a day is usually sufficient enough to remove any potential virus that may be on surfaces. Occupied areas of the building will be cleaned every evening, and high touch areas in the buildings like doorknobs, light switches, handrails, countertops in shared spaces will be cleaned more frequently. Disinfectant will be available to all staff, and staff will be trained on how to safely and properly use that disinfectant. If any additional personal protective equipment is needed, staff will have that available. They'll be instructed to share frequently used high touch, or to clean frequently used shared high touch surfaces and items before and after each use. And whenever cleaning or disinfectant is not appropriate, they will be instructed to use good hand hygiene and help the kids use good hand hygiene as well. So that means washing their hands for 20 seconds with soap and water or using hand sanitizer. All the disinfectants are on the EPA list N, which means that they're effective against SARS-CoV-2. Students will not be allowed to use disinfectants, and whenever possible, they will not be immediately present when disinfectants are in use. Cafeterias will be disinfected between groups in both the elementary and secondary levels, and students will be washing their hands before and after eating and drinking. Also, and there isn't a slide for this, I just wanted to bring this up. If there is a case of COVID or someone who's symptomatic, we do a more extensive cleaning procedure in line with the CDC to make sure that that area is disinfected wherever that person was. Ventilation. Adequate code required ventilation will be maintained as designed throughout buildings. Preventative maintenance, filter changes and repair will occur as required. Ventilation, which is the amount of outside air being brought into a space, has been increased, and all the filters were upgraded to MERV 13 or better. Testing. We are partnering with Walgreens and will have available student testing. All students will be able to be tested regularly at their school. The test is a shallow test. It can be self-administered for almost all the students. Students who require assistance will have that to make sure the swab is done properly. Testing for students is voluntary, will only be performed with parental consent. Those consent forms are going to come home in the first week of school, information about the consent, I should say. And you can either do that online and that information will be on those forms, or you can fill out the paper copy and send it back into your school building. All staff who are not fully vaccinated will be required to get tested weekly. Staff will get tested weekly at any Walgreens. The testing is free for our school or for our staff and for the students. And for your families, actually. If you want to take your families to any Walgreens, you can register and get testing done there as well. Staff who present proof of vaccination are exempt from weekly testing. And I'm going to turn it back over to Mr. Schmidt for transportation.
Okay, good morning again. On behalf of transportation, we are ready and excited to start the school year. First and foremost, everyone will be masked at all times while on the buses. If a student does not have a mask, we will have masks available for those students when they step onto the bus. Whenever possible, students will sit with members from the same household. And third, as recommended by the CDC, disinfection will take place daily on every single bus. And now it is my pleasure to introduce Mr. Glenn Vandewater, our Director of Technology.
Good morning, everybody. Today, I'd like to talk about student technology and do a quick overview. I'll start by talking about student Chromebooks, the repair of devices if one should break, MiFis. MiFis are our hotspots that provide internet for our students, instructional resources like Rcsd Learns, learning platforms, and student safety. New families to the district. Students in grades 1 through 12 who are new to the Rcsd can request a Chromebook by calling their home school or completing the form located at this link. This link will also be found on the district's website. We'll have a banner there for easy access. The homeschool or family will place an order with information management and technology. If an email address is provided, a confirmation will be sent. Families can pick up their Chromebook from their homeschool after they have been contacted by school personnel. Student account information will be provided with the Chromebook. Students that are returning to our district. All returning K-12 students have already been issued their own Chromebook for the 21-22 school year. Students will bring their Chromebook to school each day unless communicated otherwise by the school. Backpacks with padded slots for computers will also be made available as needed. For our incoming pre-K and kindergarten students, information management and technology will be assigning a Chromebook to each incoming kindergarten student. Chromebooks will be shipped to the student's home school for the start of the school year for students registered before the end of summer. Students who have a pre-K Chrome tablet from last year will swap out their tablet for a Chromebook at their assigned home school. Our new pre-K students will receive a pre-K tablet at the start of school after the start of school and after routines have been established. Now, if a Chromebook breaks, if a Chromebook needs repair, please contact your school to set up repair. School staff will help you create a help desk ticket. IM&T will repair the device and return it to the home school. Families and students should treat their Chromebook with care to help minimize repairs. If you need access to the internet, we do have AT&T MiFi hotspots through our hotspot program. All our CSD students are eligible for a free hotspot that has 50 gigabytes of data per month. These free hotspots are available until June 2022. To request a MiFi or a hotspot, please visit this link. This link will also be posted on the district's main webpage. There'll be a banner to click on, once again for easy access. The hotspot will be shipped to the student's home school. Families will be notified when it arrives to arrange for pickup. At this time, I would like to pass this presentation over to Tim Johnson, who is our Executive Director of Instructional Technology.
Thank you very much, Glenn. Good morning, everyone. I would like to share that we'll continue to have our RCSD Learns website available this year. RCSD Learns is our online resource for families and students. RCSD Learns can be found at rcsdk12.org/rcsdlearns or from the Rock Connect page on a Chromebook. RCSD Learns has a library of resources for families and students to access while at home and in school. We will also be using Google Classroom again this year. Google Classroom is the primary digital learning platform used for students in grades 3 through 12. Students can access Google Classroom using their RCSD one-to-one Google account. Seesaw will be our primary digital learning platform used for students in grades PK through 12. Students and families can access this via Rock Connect or home learning codes shared by the teacher. Families are also able to access translation in many languages, including Arabic, Nepali, and Spanish. E-learning is our platform used for online credit recovery, virtual AP, and other blended courses, predominantly at the high school level. Student safety. We use a filter called Gaggle that reviews students' digital activity on their accounts 24 hours a day, 7 days a week, 365 days a year. Gaggle provides alerts to school staff of at-risk students and serious student situations, particularly when it comes to student communication and questionable digital content. We also use a filtering product known as Lightspeed. Lightspeed is a cloud filtering product that will filter Chromebooks and Chrome devices, both here and while they're at home. The MiFi devices that we provide through the MiFi program also provide an additional layer of filtering. I'll pass it back to Glenn.
Thank you, Tim, and thank you to your entire team. It is our priority to provide staff and students with the highest level of access, support, and service for all educational and operational technology needs. I would just like to add, technology can sometimes be very confusing. Please don't reach the point of frustration. Reach out to your school, ask for help. We are here to help and provide the best customer service that we can. At this time, I would like to pass the presentation off to Chief of Schools, Dr. Green.
Good morning. On behalf of the school chiefs in the Rochester School District, we would like to share some information first around visitors. All visitors will be required to wear a mask at all times. All visitors will sign in, have their temperature taken, and take a health survey. Visitors who fail the health survey will not be permitted to enter our buildings. Family members picking up students will be asked to wait outside, weather permitting, or in the foyer, and a staff member will bring the student to the parent. Contact tracing. The district will notify the local health department immediately upon being informed of any positive COVID-19 diagnostic test result by an individual within school facilities or on school grounds, including our students, our staff, and any visitors to the district. The district will support contact tracing by keeping accurate attendance records of students and staff members, by ensuring student schedules are up to date, and by maintaining a log of any visitor, which includes the date, time, and location of the visit. Staff and families will be notified of positive cases weekly by building. Staff will receive an email and families will receive a robocall. The notification will also be posted on the district's website by building. Contact tracing and close contact. The Monroe County Department of Public Health defines close contact as being unmasked and within 6 feet for at least 15 minutes within 48 hours of symptoms or positive test of an infected individual. Only those individuals that are identified as a close contact would be quarantined by the Monroe County Department of Public Health. If the Monroe County Department of Public Health does not contact you, then there is no risk of exposure. At this time, I would like to turn the presentation over to my colleague, Dr. Kathy Black, to talk about pivot to remote learning. Thank you.
Good morning, and thank you for being with us. Even with all of the safety measures, we have to have a plan in case we have to shift to a remote environment. We will use the guidance from the CDC and the Department of Health to help us decide if we have to shift back to a remote model. We may have to shift on 3 levels. A classroom may have to shift, a school may have to shift, or the entire district may have to shift. Again, the district will seek guidance from the Center of Disease Control and our Department of Health to help us guide this decision. Families are encouraged to start making a plan of action in the event that we have to shift. If we have to shift from an in-person to a remote instructional model, we have a planned consistent model. This means that students will not return to their classroom or school and will move into a remote environment in a place of your family's choosing. Remember that a classroom can shift, a school can shift, or the entire district can shift. That shift does mean that students will not be inside of our schools. On the first day where a shift is called, the superintendent and our communications department will share with the impacted individuals, again, a classroom, a school, or the district. On the day following that announcement, students will be in a remote environment working independently on pre-planned individual activities. This means that on the day after the shift is called, students are working with what we would say in an asynchronous model. Again, they're working away from their classroom and school, and they are working independently on activities that are pre-planned by their teachers. On the second day after the shift, we'll resume instruction remotely with your teacher online at the ascribed bell times for your school. The duration and time for the remote shift will be communicated when we announce the shift. And so again, in this instance, we're talking about if we have to close a classroom or a school or the district, we will make that announcement. That following day after the announcement, students will be working asynchronously or independently with activities that are pre-planned from their school. And then that next day, the following day, we'll be resuming in a remote instruction with a teacher at the ascribed bell times online. And so just remember that a school, a classroom, or the district can pivot. We'll make the announcement. The following day, students will be working independently. And then the day after, we'll resume remote instruction with a teacher online at the ascribed bell times. And with that, I will turn the presentation back over to our superintendent.
Thank you, Dr. Black. And good morning again. The relationship between the school district and families is certainly an important one. And one way that we can make sure that that relationship is strong is certainly making sure that we stay connected. The Power School Parent Portal gives real-time access to class schedules, attendance, assignments, grades, and contact information for teachers. High school parents can also monitor their students' progress towards meeting graduation requirements. If you have not received a letter in the mail with information specific to your child, please contact your child's school. For instructions and a how-to view to set up your account, please visit www.rcsdk12.org/parent portal. In order to ensure that you are receiving communications from the Rochester City School District, your school and teacher, please make sure your child's school has a current email address, mailing address, and phone numbers on file for your family. Power School Parent Portal gives real-time access to class schedules, as I said, attendance, assignments, and grades. Please ensure that that information is up to date. Prior to turning the forum over to Deputy Superintendent Martinez Davis for questions and answers, I'd like to acknowledge two board commissioners who are participating today, Commissioner Ricardo Adams and Commissioner Beatrice LeBron, who both have children in our district. We appreciate your support for our scholars, for our staff, and our families. I'd also like to acknowledge the president of the Parent Leadership Advisory Council, Mr. Kenyon Benz. I will now turn the program over to Deputy Superintendent Martinez Davis, who will lead us through a question and answer period. Thank you.
Thank you again, Dr. Myers-Small. I just want to remind all the parents that we will be using the chat feature to go through the questions and provide you with the answers. The Q&A will work in the following manner. I will go through it and read the question. If there are similar questions, I will blend them into one. I will be asking panelists that are here with us today to come on screen to answer any and all of your questions. So again, please use the chat feature for that. So we're going to start with the first question this morning. And the first question, Mrs. Darby, if you could please come on screen, that would be most helpful. The first question for today is, what is the threshold of infection for closing a classroom or a building?
Sure. Good morning again. There isn't a set threshold for closing a building or a classroom. We work with the Monroe County Department of Health to identify close contacts. And once those close contacts are identified, they will be placed into quarantine by Monroe County Department of Health. Based on that investigation, it may happen that we decide that a classroom, an entire classroom quarantines, or perhaps even an entire school. But I will say last school year, that was a very rare occurrence throughout the county for an entire school to be closed. So it's very unlikely that that would happen, even classroom-wise, especially because we're making all of the efforts and steps when we set up our classrooms with masking and grouping, potting of kids, keeping them together whenever possible. That will limit the amount of exposures if there is a case.
Great. Thank you so much for that. The next question is about hotspots. So, Mr. Vandewater, could you give our families a little bit more information about hotspots? How can they have access to one if they do not have it, or if they didn't receive one last year?
Very good, thank you. For accessing a hotspot with the 50 gigabytes of data, which is a tremendous amount of data, parents can contact your student's home school and or go to the district website where we will have a banner where you can either request a device, a new Chromebook, if you're new to the district, or if you need access to the internet, you can also access and request a device by clicking on that banner. But I would advise you to go through your child's homeschool as it's the easiest path, I believe.
Great, thank you. Mrs. Darby, I think you would be most helpful to answer the next question. How do families register for their children to be able to participate in COVID testing? Could you go over that process for our families, please?
Sure. So during the first week, I'll say, of school, a pamphlet flyer is going to come home in backpack mail so that families can see the process for doing that. And it's an online registration. Once you've registered your student, they'll be registered for the rest of the time that we're doing testing. You only have to do it once. And then there's also a paper version. If you can't, or the online version isn't working out for you, or you can't get online, there's a paper version that you can do as well and send back with your student. And again, we are encouraging all families to take advantage of having their students tested right in school. It is a shallow test, going very, like, their fingers go farther up their nose than the swab does. Most of our kiddos will be able to, and definitely the older kids, will be able to test themselves. They'll be supervised while they do it. and no child, even with consent, will be forced to test. So if that day they're like, this isn't happening, then it's not happening that day.
Thank you. Dr. Black, the next question is about learning loss. Some of our families would like to know, what is the process that it's going to be utilized in September to assess learning loss or opportunities for students to gain some of that knowledge?
Good morning. So you can hear me, but for whatever reason, my video is not working. However, the process for addressing learning loss for our students is going to be twofold, which means that teachers will be supported to help figure out what students know and are able to do. We'll do that through a variety of measures, both things that happen in classroom with individual teachers and district-wide using some tools that we're bringing aboard for the district. Teachers will use that information to then help plan learning experiences and lessons to help students both attend to what they know and then meet the bar of what we want them to know by grade level. It will be a strong and long process to help our students both learn and recover some of the learning that may have been unfinished as a result of the pandemic, but we are committed to figuring out what our kids know and are able to do, and then giving them high quality instructional experiences to make sure that they are on tap.
Thank you so much. And thank you for reminding us that it's not learning loss, that it's unfinished learning. Now, the next question is probably going to be for any of our chiefs. Let's talk a little bit about the first day, September, and or the different meetings that happen before the first day of school, like the orientations. We have some families that have kindergarteners coming to school for the very first time, September 8th, which we are very excited to receive all our kindergartens. So really the question is about parents and visitors. So how is it going to work for parents that want to come in for orientations, visiting schools? How is that being set up?
Good morning, everyone. I'm Carmine Peluso. I am one of the school chiefs, and I'm going to take that question in two parts. Let's start with orientation. We know we're going to have students that are going to be entering the building for the first time. So we've asked schools to follow the CDC guidelines, to stagger times of orientation, and to only allow one parent to accompany the child at a time. Visitors are going to need to be signed in for contact tracing purposes in each classroom. Masks will be required at all times. And families will also need to take the health screening survey. Paper versions will be available and have their temperature taken during the orientation process. As for visitors, like Dr. Green had mentioned, parents and other visitors who are stopping by the school on a limited basis will be considered visitors. Visitors will need to be limited by the purpose, duration, and need. And whenever visitors are in the building, picking up students should wait either in the foyer or outside, and a student will be brought to you. Just to ensure if we have visitors in the building, we're also maximizing social distancing. They are screened and they have their temperature taken as well.
Great, thank you. The next question is about transportation. So our Chief of Operations, Mike Schmidt, I believe there you are, Mike. So I'm going to combine some of the questions that are coming on the chat about buses. The first one is, what type of buses should our families expect for their children to utilize for either secondary or elementary schools? And when will our families be receiving information about bus schedules?
Okay, I'll try to capture that in a brief response. So letters for transportation have been going out all week, and they will continue in the next week until every family has received notification around their bus routing. I think the second question was the majority of our students will be taking yellow bus to and from school. The only 4 schools that will be using RTS are School of the Arts, Franklin, Monroe, and 8th graders. If you have a middle school child, 7th or 8th grader at any one of those schools, they will be writing RTS service as well.
Okay, so those are, you got a little bit disconnected there. So for RTS will be Franklin, School of the Arts, and the third one was Monroe? Okay, looks like we're having some difficulties with connection. So we will go back to that question just so that our families
Franklin.
know. Oh, there we go, Franklin. We'll go back to that question, and or if Mr. Schmidt, you could type the answer right on the chat. But we did hear with clarity that Franklin and Soda are secondary schools that will be utilizing RTS buses. Okay, so we do have with us this morning Mrs. Ratley representing our special education department. And the next question is about special education and the services that we are providing to our students each and every day. So good morning, Mrs. Ratley. The next question is, what measures have been put in place to help our highest need special education students should they need to go remote? So if you want to talk a little bit about actually what are we putting in place for all our special education students, and then what happens for the ones when we have to pivot and go remote.
Good morning, everyone. Thank you. So our acting director of special education, Desiree Richmond, will be working closely with our directors, our chiefs, principals, teachers, and whatnot to ensure that the needs of all of our children with IEPs, individualized educational programs, are being met and compliant. Again, should we need to pivot to the distance learning, again, we're going to ensure that the IEPs are being met and that their individualized educational needs are being addressed. So again, the focus is individualized educational needs.
Great, thank you. And I do want to remind everybody that our first day of school is Wednesday, September 8th. We have some students that are asking that on the chat. So that's great. Thank you, Mrs. Ratley. So the next question is about parent portal. So I'm thinking that either Mr. Vandewater, our Chief of Informational Technology, or our Chief of Communications, or any of our chiefs could answer this one, which is about the parent portal. Is there a district code? Could you guide parents and families through that important process to sign up for the parent portal?
Sure. If parents go to www.rcsdk12.org/parent portal, we have video instructions there, both in English and in Spanish, that will walk parents through the process for getting signed up within the parent portal. If there's any confusion that extends beyond the instructions that are happening in the video, please contact your child's home school. They'll walk you through that process. But we've really tried very hard to make it a very simple and straightforward sign-up process.
Great, thank you. Now, the next question is for any of our school chiefs, and it has to do with what happens in a school when a student may not want to wear a mask. And we're really talking about students that do not have a medical exception, that do have to wear masks. So could any of our chiefs guide this part of the conversation as to what steps are we utilizing to teach our children the importance of wearing a mask and working with them if or any circumstance they perhaps are not buying into the process of the importance of wearing a mask?
Good morning. Thank you again for the question. So at first, just like any behavior, we're going to try to provide strategies, figure out the why a student isn't wearing a mask. Is it because of comfort? Is it the type of mask? Trying to do everything we can to make sure that we could have a mask that a student can properly wear and feel comfortable wearing. That being said, if it becomes something deliberate or defiant, we do have a code of conduct, and the code of conduct will be followed by the school administration if necessary regarding mask wear.
Great, thank you. Okay, the next question is probably for Mrs. Darby. This is a very important question, Mrs. Darby, because this really is going to allow families to know what steps to take. If they are getting tested for COVID due to symptoms, what do families have to do in order to inform their schools?
Sure. So as soon as you have any symptoms in your student, we want you to call your school and speak with the school nurse, and then follow up with the results of those tests. If you have anyone in your home who has loss of taste or smell or a high fever, we want you to keep your student home until that person is tested, especially with loss or taste or smell. That really only happens, a new loss or taste or smell, with the onset of COVID, right? There's some other things that do it, but with COVID being the prevalent thing in our community, if you have loss or taste of smell in anyone who's a close contact with your child, we ask that you keep that child home until that person can be tested. If your child is symptomatic, keep them home, have them tested. They need to see their healthcare provider. They cannot come back to school if they are symptomatic without those steps in place. That's also true for our staff. So any of our staff that are symptomatic will either leave the building or not come to work, and they will have to be tested and see their healthcare provider. If you didn't do that, we would not be able to welcome your student back for 10 days past the start of their symptom. And we would also have to talk with the Department of Health about the fact that you have, we had a symptomatic student in our building. I hope that answers the question. Probably a little more than the question, but.
No, I think so. And it's important for our families to remember that they need to call the school to report the absence.
Yes.
As well, right?
Yes,
So I'm wondering if Dr. Green can come on screen so that we could talk a little bit about that process when a parent needs to keep their child home because their child is ill. And then Dr. Green, if you could talk a little bit more about how can parents still be involved, still volunteer, still participate. There are some questions about, will parents still be able to visit classrooms, volunteer? So could you talk a little bit about the process for parents when a child is ill, what they need to do first?
Yes, I'll start with the process for when a student is ill. And as Ms. Darby mentioned, if your student has any symptoms in the morning, we ask that you keep your child at home. Upon entering school, if a child becomes ill, they are sent to the health office. A screening will be done at that point, and the health office will contact parents to pick up their child. And as we mentioned, an adult from the building will bring the child to the parent at the foyer or outside as weather permits. So the second part of the question is around parents volunteering. We are allowing for volunteers. However, in order to do that, we are asking our families to follow the process for registering as a parent volunteer through our Department of Volunteer with Mr. Ricky Frazier. He has information that he will provide to parents who reach out to that department so that you can fill out appropriate paperwork. The one stipulation around parent volunteers or any volunteer in our building is that you must be vaccinated to be a volunteer. And when you enter the building, you will still be required to complete our screening, sign in, and we must keep accurate record keeping for contact tracing.
Great.
Thank you.
Thank you. Yeah, so it's important for our families to know that they can still volunteer to help in the classes, but they do have to follow the process that is on our website for volunteers and also be vaccinated. Mrs. Darby, anything else that you want to add?
Yeah, I'm sorry. I just wanted to clarify something that when I spoke about symptoms of other people in the home versus symptoms of someone who is sick. So if you're the person, your child is the person that is not feeling well, any of the following symptoms, fever, chills, cough, shortness of breath or difficulty breathing, fatigue, muscle aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting or diarrhea are all symptoms of COVID. So basically, almost every illness, it can be attributed to COVID. And that's why it's important that that test happens so that we know whether or not that student has it. If anyone else in the family has lost a taste or smell or a high fever, we would like you to keep your child home until we know if that other person is positive for COVID, because that now limits the chance of another contact before your child actually exhibits symptoms. And they could be, and it's another safety measure that's available to us. So I just wanted to share that. Sorry for butting back in.
No, that's good. It's a conversation with our families this morning, so that's good. The next question, it's probably for our superintendent, and I'm going to group them because there seems to be some questions about last year when parents were able to select a remote option versus this year, where our hope is to have all our students back in person. And I know that you covered this at the beginning in your opening, but there are some questions about last year, my son was remote. I want remote again this year. I haven't gotten any information about that. What do I need to know if I want to keep my child remote? So do you mind going over those points that are so important for our families to hear again about the importance of having all students back in person?
Thank you, Deputy Superintendent Martinez Davis. Yes. And at the beginning of my remarks, I did share that I wanted to address the concern that I recognize that there are parents and caregivers and families that are concerned about returning their child to in-person learning. But again, we spent a significant amount of time reviewing the CDC guidelines, reviewing the information from the American Association of Pediatrics, conferring with Dr. Mendoza, who's our local representative for the Department of Health. And overwhelmingly, in-person learning really is the best choice. Many of our scholars have been in remote learning since March 13th, 2020, and we need to get them back into school. We did make the decision that if a child was medically fragile or had some underlying medical conditions, that the family could work with their healthcare provider to outline what the concerns are or were, and that would be turned into Erin Grotman, who oversees nurses and health services, and that we would do a review of that. But like other districts in the county, and certainly many of the big five, we really wanted to have, if not all, most of our students back in the district. Again, understand that there are concerns. And so the question is, so then if I'm still not comfortable, then what do I do? And if I don't have a medical exemption? And so, I don't want this to sound harsh, or I don't want it to sound that we don't care, but the option would be to homeschool your child. And certainly we can process that information. If you want to homeschool for a little bit of time and then come back in the district, that's something that we can do as well. But we have taken the stance that it really is important to have our scholars back in school.
Absolutely. Thank you so much for that. The next question, I think probably Dr. Black, our Chief Academic Officer, would be most appropriate. So we do have some questions about how are we going to help children with the writing skills due to so much on the computer last year. There are some questions about what type of instruction and assistance should parents be expecting for our students when it comes to those very important literacy skills?
Yes, so thank you again. So I'll reiterate the fact that we are going to go through a very slow and deliberate process as we determine what our kids know and are able to do based on the last 15 months of learning. While we did not have full in-person instruction for the last 15 months, our kids were able to access instruction from our both our remote and our hybrid. As we receive students back to the school this year, and we identify what they know and are able to do, our teachers will provide supports and instruction. In terms of the question around handwriting, writing, and getting our baby's fingers back to doing the things outside of a keyboard. That's all a part of us figuring out what our kids know and are able to do. And our teachers will modify and tailor instruction to make sure that our babies get the supports that they need to both be able to attend to learning that's on a computer, and of course, be able to write and color and do all the things that we know need to happen in a well-rounded school experience.
Dr. Black, can you also talk a little bit about how classrooms are going to be set up? What kind of instruction should parents, be expecting? There are some questions about class sizes. How is the classroom going to be set up, and so forth?
So we will be using our class size guidelines as indicated by all of the things that support us. So our class sizes can be up to 22 up to 25, depending on the grade level in the classroom. So that will be typical. All of the furniture that a teacher could expect to be in a classroom or a parent could expect to be in a classroom is being returned. And so teachers will be planning their instruction with a full complement of materials and spaces that they had pre-COVID, pre-pandemic. And then again, learning instruction will both be whole group. So a teacher could be teaching the whole class, small group. So a teacher can be working with a small group of students who have a similar need or a similar learning target, or even individually where a student has to provide, a teacher has to provide one-to-one support for a student to help that student meet the bar of the grade level instruction. So what parents can expect in classrooms is that teachers will be doing their due diligence, like always, to ensure that students get what they need when they need it, and in high quality learning experience. You should expect books. You should expect manipulative, so things that kids use. You should expect reading. You should expect writing. You should expect numbers. You should expect wonderfulness for what happens inside of our classrooms as we receive students back and help them meet the expectations of grade level by figuring out what they know, what they're able to do, and then working with our wonderful teachers to close those gaps.
That's great, thank you. And I know some of the questions in our chat are very specific to a situation that is happening either in your household or for your child when it comes to the transportation. So for those, we will be answering those individually. We are really going over questions that are more general in nature this morning. So I just want to let our families know that if I don't go over your question, because it might be specific to you and your family, you will get an answer from an Rcsd staff. So the next question is about vaccination. So Mrs. Darby, can you share with our families a little bit about students that are over 12 years? Where can they go for vaccination? How are vaccines being provided? Is it easy and accessible for them and for their families? There's questions about where do I go? I want my child to get vaccinated. Can you share with our families where to do that?
Sure, absolutely. So right now in the community, in the Rochester community, there are a number of opportunities and places that have walk-in availability for vaccines. Any of our local drugstores, Walgreens, CVS, Rite Aid, Wegmans, Walmart, all have walk-in availability. The county also still holds pop-up clinics as well as a daily clinic. The hours vary for that. And what I will do is get that information in the chat for everyone. You can also go to the Finger Lakes Vaccine Hub, and that can give you more information on where to find a vaccine. We are also working with Walgreens to offer more vaccine opportunities on site. We don't have those plans in place to share them in detail at this point, but we are working with them to do that. And last year, at the end of the school year, we were able to offer a vaccine site at every single school building. So we will, we are continuing to explore all opportunities to get vaccination right on site. And as well, it's very, very available in our community. Again, any drugstore, Walgreens, Rite Aid, CVS, you can walk in and get a vaccine. Children are eligible for the Pfizer vaccine, children 12 and up. And then adults 18 and over, some of them are still kids, I guess, but 18 and over are available for all 3 vaccines, Pfizer, Moderna, and Johnson & Johnson.
Great, thank you. Dr. Black, there are some questions about instruction when a child is sick, not the entire class pivoting to remote, but when there's one child that's out, what is going to be the process this year? Is it the same as last year? Is it different? What happens when a child in a particular classroom is absent due to illness?
So if a student is absent due to illness, we will provide independent work for that student. So a parent and or a caregiver or a trusted friend will need to be able to come to the school to obtain work for the student that they can work on independently. Alternately, we may have options available that students who have their technology at home and who are also at home because of illness will be able to access independent work from their school-based remote learning account. So we know that every classroom will have the opportunity to engage with instruction that they can find in their computer. And students who are home for sickness or for any other reason can access also information from their remote, from their student portals or classrooms that are found on their computer to be able to attend to what's happening in the classroom.
Great, thank you. Thank you so much. Dr. Green, we have some questions regarding orientation. It's exciting to see all these questions about orientation because that means that parents just like us are very excited for that first day of school. There are some questions about process for orientation. Do parents have to be vaccinated in order for them to come in for to bring their child to orientation? Will there be orientation in person or virtual? And can both, if the child has 2 parents, can both parents attend or just one? So it's really in general, a little bit information about orientations that should be happening pretty soon.
Thank you for that question. As my colleague, Dr. Peluso spoke earlier, we are providing orientations at our school buildings. Schools will be sharing that information. The guidance around orientation will be that they will be staggered throughout the day or days. Some of the orientations will be a combination of in-person and virtual. Parents are allowed to come into the building during orientation. They are not required to be vaccinated. However, vaccinations always help as we encourage everyone to be vaccinated. But the process will be the same as a visitor where you must come in, you will be temp checked, you will have to sign in for contact tracing purposes, both in the front as you enter the building, as well as the classroom, so that we know what locations any of our visitors have been in. Those orientation dates are set by the school. If you have not heard specifically from your school, you should reach out to the school and speak with the office staff or the principal so that they can provide that information to you. Thank you for the question again, Deputy Superintendent.
Yes, thank you. Thank you. So the next question is probably for Mr. Vandewater. Mr. Vandewater, could you go over MiFis, the students that received them last year? Should they return them? Should they keep them? If you're a new student, how would you go about getting, again, a hotspot and your tablet? There are some questions that are surfacing on the chat again about the technology that our children are going to be receiving. And if the technology doesn't work, what do they need to do?
Very good. Thank you for the question. I'll be posting a link in the chat. However, to start with, if your child has a first generation hotspot that came with only 10 gigabytes of data, that can easily be swapped out for our hotspots that now have 50 gigabytes of data. And again, this is good through June 2022. Requesting hotspots can be done through 2 modalities. First, you can contact your child's home school, or like I had said, I'll be posting a link in the chat to request either a Chromebook or a hotspot. if one needs to be replaced, or if you're new to the district. I would like to add for clarity, the best way to get broken Chromebooks, charger replacements, is to contact your child's home school. That is the fastest and easiest way to have a broken device replaced or a charger replaced. Thank you.
Great, thank you. So I have been asked to slow down a little bit for our translator. So thank you, Mrs. Lopez, for that reminder. So we will make sure that we take pauses as to allow our interpreters to translate for our parents. So the next question is for any of our school chiefs. And this question is about clubs and activities that take place after school and concerts that take place in the evening. We have some families that would like to know if they should expect their children to be able to participate in clubs, musicals, dances, concerts, etc.
Good morning once again. As of now, yes, we will be holding clubs after school for students where social distancing and the same guidelines that we follow in school will be followed. As for concerts, last year we did do some concerts virtually that were very successful. So there will be a blend of virtual and, when possible, in-person concerts. Once again, social distance, CDC guidelines, screening, masks, temperature checks will all be needed. Thank you.
Thank you. The next question is about athletics and or sports. So I'm wondering if, oh, great. Thank you, Dr. Black. Thank you. So the next question is about physical activities and sports protocols with regards to masking. Will masks be worn at all times indoors and outdoors during physical education classes, during sports activities?
I'll take the first part and then invite Miss Stacy Darby to come on if I miss any pertinent information.
Perfect.
So as of right now, we are asking that masks be required for both indoor and outdoor activities, and will be required for all of our sports practices and athletic activities. We are looking for and waiting for updated guidance about whether masks will be required and worn during the actual physical games that students play, so the actual physical competitions. But for all practices, indoor and outdoor activities related to athletics, athletic activities, masks will be required and social distancing protocols will be adhered to. Stacey, I hope I got it, but if I didn't, come off and clarify.
That was perfect.
Yay, thank you.
Yeah, we have universal masking. So masks at all times by staff and students alike, indoors and outdoors. The next question is about kindergarten orientation. So I'm hoping that one of our school chiefs would be able to answer if orientations this year for kindergarteners will take place.
Thank you again. As previously discussed, we will be holding orientations. They will vary by school. Some of them are in person and some of them are virtually. However, I would encourage you to reach out to your school directly so that they will be able to share that information. In addition, many of our principals are in the process of sending letters home to families to inform them of all of the orientation dates, as well as answer some of your questions.
Thank you. Now, Dr. Green, should families also reach out to their schools about the cafeteria and how each school is going to be setting up their cafeteria? Will there be plans shared with families? How would families find out? There are some questions about lunch times, and I know it's going to vary school by school.
Thank you for that question. In addition, for cafeteria setup, because of the sizes of our cafeterias, they vary across our buildings. So each school has been working on a plan for their setup. All school principals are working on a safety and health guidance document that will be posted on their website with all of the details about cafeteria, as well as some other things such as arrival and dismissal, how classrooms are going to be set up. So that will be posted on all of our schools' websites before school opens with the details. However, if you do have specific concerns, feel free to reach out to your child's principal at any time, and they can give you specifics at this time as well.
Could you talk a little bit about school supplies, lockers? What and how will that be taking place this year?
So in terms of school supplies, we are allowed to share materials, very limited. However, the CDC guidelines are to make sure that students are washing their hands or hand sanitizing before and after use of those materials to help with the spread. And in terms of lockers will be used for our schools, specifically in our secondary schools where we do have lockers. And again, as we have our schedules in place, that will limit the amount of students in the hallways and using the lockers at that time. I will ask Ms. Darby if there's anything else around safety precautions around sharing materials or lockers that you would like to add to that.
I think that that's perfect. We will, if we don't have to share a material, we won't. If we have to share a material and it can't be disinfected between use, then hand washing will be the step that we use to make sure that there isn't spread. I want to remind everyone as well, as more science and more information has come out, the formite, which is what COVID is on a surface, right? Isn't spreading, isn't causing disease. That's really what they're seeing, but we still want to take these extra precautions just to be safe. Same thing with locker use. Someone going to a locker who's even has someone next to them for that very short amount of time while they're masked, they get their things out of their locker and they go and they move on to their classroom. That is a very, very low risk interaction and is one that is safe to take place.
Great, thank you both. Dr. Black, let's talk a little bit about music classes. There are some questions about will students be allowed to play instruments this year, band or lessons? Do they need to wear PPE? And I know that you have been very involved in ensuring that these classes are special area classes like art and music continue to provide students with a well-rounded education. Yes. Could you talk a little bit about how at Rcsd we are ensuring that these continue and what measurements we're putting in place?
Yes, thank you. So with a return back to 100% in-person experiences for the majority of our babies, we are then bringing back all of the access to art, music, physical education, our extracurricular activities, including sports and clubs. In particular for band and or choir, we are obtaining the appropriate PPE that will allow for our students to resume playing their instruments and resume participating in choir with the appropriate safety precautions. And so, yay to announce that band will resume, our babies will be able to play in person, and they will have the appropriate safety masks that are have the holes for the instruments and have the covers for the big tubas. So we are on it, we are doing it, and our babies will be able to play instruments and sing like they did before we closed in March.
Great, thank you so much. That is so important for our families to know. I want to remind that some of your answers are right on the chat. We do have staff that are answering some of your questions. So please make sure that for our families, you continue watching the chat. The volunteer coordinator information for Mr. Ricky Frazier has been added to the chat. In addition to that, we have added to the chat the link on our website where parents can, or any family member can go and complete that volunteer application. There are some questions again about technology. And I know that Mr. Vandewater, you already answered some of these, but the questions keep coming up about if the Chromebook or charger is not working before school starts, should families be reaching out right now to their schools so that they are ready to begin Wednesday, September 8th?
Yes, families can begin reaching out to their child's home school if there is an issue with their Chromebook and or charger. Once again, it may take a few days for those devices, excuse me. Yep, it may take a few days for those devices to reach the school and for that transaction to happen because we still are in summer vacation. But we'll work very hard to make sure that device is replaced and the student has access to a working device prior to the start of school.
Great, thank you.
I would like to add devices will really be able to kick in fixing devices once school begins, but receiving that communication really allows us to get some advance notice as to what the concern is.
Great.
Thank you.
Thank you. Dr. Black, let's talk a little bit about the difference this year when students were in Zoom and they were zooming into the classroom. There are some questions about if a student stays home this year, will they be able to zoom into the classroom? So I want to make sure that our families really have a good sense of the difference of what we're doing this year and how in-person instruction will happen and how synchronous instruction will not be the norm. But if we have to pivot, that's when that synchronous instruction then happens. Could you talk a little bit about that, please?
So thank you. So to be clear, we are as Rcsd returning to 100% in-person learning environment, meaning that we expect that all of our students and hope that all of our students will return to our in-person learning as we did pre-pandemic. So 100% of our students in classrooms in person. As a result of that expectation and us moving forward in that way, there will not be an option for students to Zoom in or remote in unless they have received the appropriate medical accommodation and or we have called for a shift to remote instruction either by classroom, by school, or by district. And so if a student or parent opts to not send their students to school, they will not be receiving a remote link for students to Zoom in. And as our superintendent messaged, the options for those parents include potentially adhering to a homeschool option, which they can reach out to us to support with the appropriate documentation. So high level is that we will not have a Zoom link for a student or family to remote into unless a school has gotten the shift to remote instruction by word of the superintendent under the advice of the CDC and the health department.
Great, thank you. Thank you so much. Mr. Schmidt or Mrs. Darby, the next questions, I'm going to group them, and it's really about the process that our schools are going to be utilizing when it comes to cleaning and disinfecting classrooms. Could you remind our families what that process will look like?
Sure. As I mentioned before, formally transmission, which is the disease on a surface, really has not been shown to be the cause of COVID when people catch it. The cause is close contact and droplets from one person when they're breathing, coughing, sneezing, talking, getting to the other person, and then that person breathing them in. We still will be following the CDC guidance, which says that cleaning of classrooms and spaces should take place daily. So that's what we'll be doing. And then in high surface, high touch areas, high traffic areas, I'll say, those areas, places that are touched more frequently, will be disinfected more frequently. If we have a positive case, we go in and disinfect every surface in the areas where that person was in the last 7 days. And then we also do that if someone goes home sick as a preventive, so that, okay, they're homesick, we're not sure why they're homesick, we're going to do the disinfection that evening. If we find out about a positive case during the school day, we will have that classroom or space emptied, or spaces. They will be disinfected, and then people would be allowed to reoccupy them after about 20 to 30 minutes, depending on how long it takes to get the disinfection completed.
Thank you. Dr. Black, I think you're going to have one of the last questions of this morning, and that is about the type of education that our students that do have a district approved medical exception will be receiving. Do you have any information on that?
So the students who do have a district approved medical exemption will be receiving support through our home hospital program. And so they'll be having our teachers reach out to those folks to then identify what instruction looks like that best meets the needs of the students and holds the bar for what we want students to know and experience through learning.
Thank you. And I think the last question of the day is really about that screening. So Mrs. Darby, can you remind one last time to our families what the daily screening that they have to do before their child gets on the bus is?
Sure. So families will be receiving reminders via robocall to screen their students every morning before they get on the bus or before they arrive at school. That includes a temperature reading, families taking the temperature of their student. Temperatures need to be under 100.4 without the aid of any fever reducers or medications. They also have to screen for the symptoms that I mentioned before, and those will be in the robocall and also in the parent packet information packet that's going to be going home to families, or available on our website for families. They also have to answer if the student has had a close contact with any positive case. So a reminder in the last 10 days. So a reminder of that is close contact is someone who you were with that person within 6 feet for longer than 15 minutes, unmasked, within 48 hours of that person becoming ill, or within 48 hours of their positive test if they had no symptoms. I think I got all of the, I don't have the screen in front of me and now my brain is freezing. I think I got all of the questions, but they will be reviewed and sent out. Staff also will be answering those same questions either before work or upon arrival to work, to make sure that we are not coming to school sick. And that is what's really important, not coming to school sick and not coming to school if we had a close contact or if we've been directed to quarantine by the Monroe County Department of Health.
Great, thank you. So I will pass it on to our superintendent, Dr. Myers-Small. And I just want to remind all our parents that we do have a parent guide, back to school guide for all our RCSD families, which is posted on our school website. And as you can see here, it's being demonstrated to you. You just go on rcsd.k12.org and you will there find our back to school family guide. Currently it's in English. Throughout next week, this guide will be posted in the different languages that we have here at the district: Spanish, Nepali, Arabic, Somali. So parents, please ensure that you visit our website for additional information and to access our back to school guide, which has a lot of good information about many of the topics that we spoke about this morning. So with that, thank you so much. And Dr. Myers-Small.
Thank you so much, Deputy Superintendent Martinez Davis. I certainly would like to thank the entire team who participated this morning. So certainly teaching and learning, the Office of Special Education, the Technology Department, operations, including health and safety and transportation, the school chiefs, It truly does take the entire district working together to help ensure that we have a safe return to in-person learning. I'd like to thank all the parents and caregivers and community members who participated and took time out of their busy schedules to ask us very thoughtful and very pertinent questions. We certainly appreciate that. And it's our hope that through this exchange this morning, through chatting and responding to questions posed in the chat, and that our back to school guide for families is helpful. So we thank you. And certainly in order for all of this to come together, our communications department operating, they're literally holding everything down by making sure that the technology flows, that we stay connected, and that they also help to respond to questions in the chat. So thank you so much to our communications department. I want to reiterate my thanks, our thanks to our commissioners. Those who were here today were Commissioner Amy Malloy, Commissioner Beatrice LeBron, and Commissioner Ricardo Adams. All have children in the district. And so certainly thank you for participating today and your continued support of the district. Shout out to Mr. Kenyon Binns, who is the president of the Parent Leadership Advisory Council. We appreciate the partnership and the collaboration. The one last thing that I'd like to share with you before we formally close is that as the superintendent, it is very important to me to stay connected and engaged with parents and caregivers. With that, in a few weeks, I will be sending emails through the Parent Leadership Advocacy Council to develop what I'm calling a parent rapid response team. There are many decisions that I need to make that impact the district. And so I certainly confer with the Board of Education. I confer with my cabinet, with principals and teachers. And I want to make sure that parents are a part of that. And so this parent rapid response team would be a cadre of parents whom I could quickly reach out to and ask if they could join me on Zoom for me to solicit feedback or to run a particular situation by them and to get information from a parent and caregiver voice. So I'd ask that you please stay tuned for that information. And if that's something that you would be interested in, more information will be provided, and I would encourage you to sign up and participate. We certainly hope that all of this information, and I know we presented a lot of that to you this morning, has been helpful. As Deputy Superintendent Martinez Davis shared, we will be posting this information, this presentation on our website for future review. Additionally, we will be sharing important information to our principals so they are prepared for questions and to ensure that they're ready to really move forward as we open schools. We certainly hope that you have a great Saturday, that you have a wonderful weekend. And on behalf of the entire Rochester City School District, we are excited and cannot wait to welcome your children to our schools, whether they're a pre-K student or getting ready to graduate soon. We're looking forward to seeing them in person. Have a wonderful weekend, and thank you for your time today.